Afternoon, good morning, good evening to everybody. Thank you to the organizers for the opportunity to present some data from South Africa. So the presentation will be done in two parts. I will be discussing the hepatitis B review of data, and Dr. Khomotso Vilakazi will be presenting on the guidelines and action plan. So I am Nishi Prabdel Singh from the National Institute for Communicable Diseases. So this is the map of South Africa showing you the 9 provinces and also showing you the density for each province. So the lighter shades showing you very sparsely populated provinces, and the more brown or reddish shades showing you the densely populated regions of the country, like Gauteng. The population of South Africa is approximately 59 million. The average number of children born per year is approximately 1.1 million, and there's an estimated 90% hospital births. The vaccine, hepatitis B vaccine, was introduced in 1995 in our expanded program on immunization. The vaccine coverage for our BCG dose at the moment stands at 86%, and our third dose Hep B vaccine for 2020 was around 84%. So just to remind you that the hepatitis B transmission risks in South Africa are usually four ways. And the first one is horizontal transmission. So that means children younger than the age of 5 can transmit the virus from one child to the other. And that was our most highest transmission risk in the country. And the reasons for that was the lower prevalence of e antigen positivity in mothers before the HIV era. And also it was, presumed that children are coming to close contacts, contact with household people, adults who had hepatitis B, and also they scratch and fight with other toddlers and younger children and transmit the virus early on in childhood. The second transmission risk is through perinatal, and this had an impact on the HIV-HPV co-infection in pregnancy, where pregnant women who are HIV positive are 3 times more likely to test positive for DNA, for HPV DNA with higher HPV DNA viral loads, and they're twice as likely to test positive for e antigen. And there's an increased risk of mother-to-child transmission with 90% risk of chronicity in children. When baby is born to Hep B positive moms. Sexual transmission, obviously adults born before they had the vaccine, that's pre-1995, can transmit by sexual means, and percutaneous transmission like needle stick injuries in healthcare workers. So I am presenting data from studies in South Africa. So South Africa has a very rich history with hepatitis B, and dating back to 1980. But in the more recent surveys that are taken place in the country nationally, some of the data that comes through showing here larger sample size, showing HPV surface antigen prevalence in adults ranging from 3% in HIV uninfected individuals to around 8% in HIV infected individuals. Just to bring your attention here, that a lot of these studies are using samples from other surveillance groups, and that's quite novel, and it's quite interesting to see the data that's coming out, from KwaZulu-Natal, for example, on the COPRISA AIDS treatment program, as well as the HIV incidence provincial surveillance system. Hepatitis B surface antigen prevalence in children. Again, if we compare unvaccinated children from the 1999 study done by Vardis, she showed a high prevalence of 10.4% in unvaccinated children. And in our recent studies, we are showing 0.4% HBs antigen prevalence in the recent studies. However, some of the sample numbers are smaller, and I will show you now data from our 2019 study, where we see that in a 0 to 4 age group, in national laboratory, passive laboratory surveillance, you can see detection rates or positive cases in the 0 to 4 year age group is about sitting at 3.3%. And that just shows that hepatitis B virus is still present in the younger age groups. And collectively, if we look at from the 0 to 24-year-old age group, we are reaching around 13% positive cases tested for HBs antigen. So it just shows that we still have a problem in South Africa, especially in those individuals that should have been vaccinated. And then this is recent data coming out again. This is a publication that's due to be released. It's from 2015 to 2019, collective data showing you in the age group 0 to 4-year-old, there's quite a few positive cases. And if you look at the blue bars, they're showing you in the region of, in the age group 0 to 1 year, that's the number of positive cases per province is quite prevalent. So once again, we can see that in the 0 to 1 year age group, we're still having an issue with hepatitis B. So I've summarized the data very quickly from as early as 1999 to our present studies. There is known evidence, as I've presented, that the gains of Hep B vaccination in South Africa has been largely felt when we compare data pre-1995 and post-1995. The data provided that there are still cases of hepatitis B infection in the country in the age group that should be protected. And this could be due to poor vaccine coverage, mother-to-child transmission is taking place, and this is concerning data that shows that in the 0 to 1 year age group, there's quite a high prevalence in those age groups. And of course, vaccine hesitancy is something that we need to address. In order to curtail some of these, we have to roll out programs introducing the birth dose in the country, screening all antenatal women in the clinics for hepatitis B, and of course, follow up the mom and child pairs. Thank you. I will now hand over to Dr. Vilakazi.